In this video, we're going to talk about a really important topic: who should avoid taking psychedelics. While psychedelics like magic truffles can be helpful for many people, they're not suitable for everyone. It's crucial to understand the potential risks and check if they're safe for you before trying them. We'll cover some specific health conditions that could make psychedelics dangerous, why it's essential to be honest about your health history with your guide or facilitator. So let's dive in and learn more about staying safe with psychedelics. For example, think about a friend who loves weightlifting and tells you how great it makes him feel. You want to try it too, but you forgot to tell them about a shoulder injury you had before. When you try to lift the weights, your shoulder hurts a lot and you wish you hadn't done it. Using psychedelics when you have certain health issues is like lifting weights with a hurt shoulder. It's not a good idea and it could make things worse. Before thinking about trying magic truffles or any psychedelic, it is very important to look at your health history and see if there are any reasons why it might not be safe for you. Let's talk about specific mental health issues and the use of psychedelics. People who've had certain mental health problems, especially ones that make it hard to know what's real, should not take psychedelics. This includes things like schizophrenia, bipolar disorder with manic episodes, and having a family member with these conditions. Also, people who are struggling with PTSD, severe depression, or panic attacks due to psychological vulnerability should not be taking psychedelics. Your mind is like a well-kept garden. Adding psychedelics when you're likely to have certain conditions is like adding a strong, unpredictable fertilizer. It might make some plants grow nicely, but for others, it could mess up the whole garden. If you or someone in your family has had a history of psychosis, schizophrenia, bipolar disorder, or other psychological vulnerabilities, it's best to be extra careful and avoid psychedelics completely. Let's now talk about physical health and psychedelics. Even if your mental health is good, some physical health problems can make psychedelics a bad idea. Heart problems, epilepsy, and being pregnant are some of the things you need to think about seriously. Your body is like a well-tuned instrument, so taking psychedelics when you have a certain physical condition is like playing a loud chord on a fragile string. It might work well sometimes, but it could also break. So putting too much stress on the instrument, or in this case your body, might make it break. People with conditions like heart issues, epilepsy, or who are pregnant or breastfeeding should not be taking psychedelics because of the possible risks and problems. Finally, let's talk about medications and psychedelics. Some medicines, especially SSRIs and MAO inhibitors, used for depression and anxiety, can be dangerous when mixed with psychedelics, especially when increasing the risk of serotonin syndrome, which can be life-threatening. So imagine a friend who takes a medicine to control their diabetes. They know they need to watch their blood sugar levels closely and avoid things that could mess up how well the medicine works. In the same way, people taking SSRIs or MAO inhibitors need to know that psychedelics could interact badly with their medication and put the safety first. Your brain chemistry is like a complicated recipe, with each medicine being a specific ingredient. And when adding psychedelics to the mix, it can be like throwing in a really strong spice. It can make the dish taste better for some, but for others it could overpower everything and create an unpleasant or even harmful result. So, always tell your guide or the person helping you about any medications or supplements you're taking. If you're on SSRIs or MAO inhibitors, it's very important to avoid psychedelics because of the possible dangerous interactions. So let's recap what we learned today. Psychedelics can be incredibly beneficial for some people, but they're not a one-size-fits-all solution. If you have certain mental health conditions, physical health problems, or are taking specific medications, psychedelics could be risky or even dangerous for you. The most important thing is to prioritize your safety and well-being. Always be honest with your guide or facilitator about your health history and any medications you're taking. If you're unsure whether psychedelics are right for you, talk to a trusted mental health professional who can help you make an informed decision. And remember, taking psychedelics is a big responsibility. By educating yourself about the potential risks and contraindications, you're taking an important step in ensuring a safe and meaningful experience. So stay curious, stay informed, and stay safe out there.